CM is a 45-year-old woman here with 6 hours of right upper quadrant abdominal pain that started a half an hour after eating fried chicken for lunch. The pain's 8 out of 10, sharp stabbing, and radiates to her right scapula. She reports prior similar episodes of postprandial pain after eating fatty meals for the past 2 weeks that resolved on their own, that she had previously attributed to heartburn. She reports subjective fevers and nausea today, but no vomiting, diarrhea, or bloody stools. The pain's aggravated by deep inspiration and pressing over the area, and nothing seems to make the pain better. She denies chest pain and shortness of breath and has no urinary complaints. She's sexually active with one partner. She denies chance of pregnancy as she's had a tubal ligation. She also denies vaginal discharge or any abdominal trauma. Her past medical history is significant only for hyperlipidemia and asthma. She takes atorvastatin and albuterol for those issues. She denies use of any over-the-counter NSAIDs. She's had 2 C-sections, otherwise no abdominal surgeries. She's allergic to penicillin, which gives her a rash. She doesn't smoke, drink, or use any drugs. On exam, her vital signs were significant for a fever to 100.8. Her heart rate was 90, her blood pressure was 135/70, her respiratory rate was 18, and she's sitting 98% on room air. In general, she's well-developed, well-nourished, obese woman who's in some obvious pain. Her sclera are anecteric. She has, on her chest exam, no obvious deformities or bruising. Her chest wall is non-tender to palpation. Her lung sounds are clear to auscultation bilaterally with no wheezes, ralls, or bronchi. Her heart had a regular rate and rhythm, normal S1, S2, and no murmurs, rubs, or gallops. On her abdominal exam, she had a prior C-section scar. I thought her bowel sounds were a little bit hypoactive. She was focally tender in the right upper quadrant with no rebound or guarding. She did have a positive Murphy's sign. She had no McBurney's point tenderness, no hepatomegaly, and no shifting dullness. She also did not have CVA tenderness. I performed a chaperone pelvic exam. She had no vaginal discharge, no cervical motion tenderness, and no adnexal tenderness. On her musculoskeletal exam, she had no calf tenderness or swelling. We performed a bedside ultrasound that showed multiple stones in the gallbladder. The gallbladder wall was measured to 6 millimeters, and she had a positive sonographic Murphy's sign, but no pericholecystic fluid. The common bile duct was not visualized. In summary, this is a 45-year-old obese woman here with 6 hours of right upper quadrant abdominal pain radiating to the right scapula associated with fever and nausea after eating a fatty meal. The presentation is most consistent with acute cholecystitis given the ultrasound findings and positive Murphy's sign. I'm also considering choledocholithiasis and acute pancreatitis. Hepatitis seems less likely because she doesn't drink alcohol, and I doubt that hepatotoxicity from atorvastatin would present with acute pain like this. I don't think that she has acute appendicitis given the location of her pain, and despite the fact that she has pain on inspiration, she has no shortness of breath, no hypoxia, no signs of DVT to suggest PE or another pulmonary etiology for her pain. The biggest life threat would be ascending cholangitis, but she has no signs of jaundice, she's normotensive, and she has no altered mental status. In terms of plan, I would send a CBC, a Chem7, LFTs, lipase, a UA, and a urine pregnancy test, just in case. I'd order a formal right upper quadrant ultrasound, and we'll likely need to consult surgery pending the results of those tests. If by some strange set of circumstances those studies are normal, we will have to explore whether or not we want to send her for a CT of the abdomen and pelvis to explore less likely diagnoses. I'd give her morphine for pain, avoiding ketorolac in case she needs to go to the OR, a 500cc bolus, and ondansetron for nausea.